मिली खोश प्रेजेंट्स डॉक्टर्स के साथ सवाल जवाब। आज हमारे साथ है डॉक्टर अंकिता वैद्य। सो मैम, आप प्लीज हमें बताइए व्हाट आर द सिम्टम्स ऑफ एचआईवी।
HIV is a viral disease. It has different phases of infection. In early phase of infection, when it may be symptomatic or it may be completely asymptomatic. In early phase, when actually the person acquires an infection, the person might have a symptom of common viral like sore throat, fever, rash, or lymph nodes swollen in the neck. So these are the common symptoms that can be noticed in early phase of infection. And apart from this, in later phases, once it becomes the virus is there, it has already damaged the immune system, it has become chronic. Depending upon how much damage it has done to your immune system, different other infections come into picture, and according to that it starts showing the symptoms of other infections. So sometimes show the symptoms of like chronic cough, chronic diarrhea, prolonged fever, undiagnosed cause of fever, or these reasons, and then patient go for testing and they test for HIV, and sometimes it comes that it is the HIV infection that is causing in the background all these symptoms.
मैम, जैसे आपने सिम्टम्स के बारे में हमें बताया, तो उसके बाद क्या करना चाहिए? कैसे पता चलेगा कि कौन डॉक्टर है, किस डॉक्टर के पास जाना है? आम आदमी को पता नहीं होता है कि विच स्पेशलिस्ट दे नीड टू सी। सो मैम, थोड़ा सा बताइए उस बारे में।
There are very few numbers of doctors who actually practices in HIV medicine and are expert in the field. These are usually infectious disease specialists, and you need to see the expertise of the doctor because HIV is an infection, it's a viral infection, and the HIV patient can be having multiple other infections also, and it is required to understand which kind of infections are these and to look for that, to start the treatment according to the drug interactions with HIV medicine. Or sometimes we have to delay the introduction of HIV medicine also when the patient is having certain serious infection like cryptococcal meningitis or a brain tuberculosis. So in that case, we have to delay the introduction of antiretroviral drug or HIV medicine, HIV drugs. So the expertise is required to manage this infection because they can have a common infection, but very commonly we see rare infections in HIV which has to be managed with clinical expertise and the expertise in infectious diseases.
सो मैम, एक और चीज़ हमें प्लीज़ क्लियर करिए कि इज़ इट क्योरेबल, इज़ HIV curable, and how long does it take to cure, and is there any particular precautions that patient need to take? थोड़ा सा मैम इस बारे में भी हमें बताइए।
If somebody is having HIV infection, we can control the virus multiplication and as such the damage to the body. So if you are taking antiretroviral drug, that means anti-HIV medicines on time, the virus multiplication can be controlled and the damage done by HIV can be controlled, and it's not there. Also we need to understand that in HIV with the medicines the results are so good with less of side effects, but the right medicine combination has to be there based on the patient profile. So everybody doesn't fit in for the same medicine. Also we need to understand one more thing, that it's a chronic disease. So you need to take care of your lifestyle, because if you're taking one pill a day regularly, yes, we need to monitor your liver function, kidney function for a long run. Also for development of any bad blood sugars or cholesterol. So you can go for good number of exercises, regular exercises, a healthy diet that will help you to stay fit. Even with HIV, I can just simply say it's a chronic infection, but if you're taking your medicines on time, you can stay as healthy as others are.